Welcome to the life cycle of the patient. This video will go over how Clear.Dental sees the patient in the form of a particular life cycle. This video is more towards people who are using Clear.Dental. However, there is nothing in this video that is specific to the Clear.Dental EHR per se, so you can actually use this outside of the actual Clear.Dental ecosystem. So how does it all work? Let's start in the top left. Patient fills out the new patient form. There'll be a separate video about the new patient form, but one of the key aspects of the new patient form is that it'll actually tell the front desk what kind of patient actually applied. For example, the patient could be in pain or is just looking to get an exam and cleaning. And depending on what the patient wants to get done, we will schedule them accordingly. So the perfect example is that a patient could have a broken tooth that is absolutely killing them, and they want to get it fixed either by an extraction or fixing the tooth itself. So they're not going to be interested in comprehensive exam or getting x-rays. They want that particular problem solved first. So in this form, they would say, yes, I am in pain, and then they would get what's called a limited exam. So everything here is using the US standard D codes. So a limited exam here in the US is a D0140. And then the patient would come in specifically for whatever needs to be done. So back to that example, they have a broken tooth, we would fix that broken tooth. Now, that's not the end of it. We want the patient to come back for the comprehensive exam. The best way we would actually describe that is like, hey, you got a broken tooth, we want to prevent further teeth from breaking down. So why don't you come back, we'll look at all of your teeth. So that's what this comprehensive exam is all about. Limited exam is more or less limited to just one tooth, while a comprehensive exam is more meant for all the teeth, basically everything in the mouth. Now, this is a little bit specific to my own dental practice, so lots of doctors are going to disagree with me. That is perfectly fine. But for the sake of Clear.Dental, we're just going to say that if there are a number of issues, like lots of broken teeth, a lot of teeth that needs to be fixed, we would do what's called a full mouth series of x-rays, which has its own D code. Or if they don't have that many issues, then we would just do 4 bite wings, 2 periapicals, and that's it. Whenever Clear.Dental does support panoramic radiographs directly, it would probably be integrated with either both or at the very least with the 4 bite wings. So at the end of the comprehensive exam, the patient will actually be given a full treatment plan. Now, in that treatment plan, there's going to be a number of procedures, and these procedures will be phased. So there will be actually phase 1, 2, 3, 4. Actually, Clear.Dental supports n number of phases, so you could technically get all the way to phase 99, but for the most part, most doctors don't actually go beyond phase 5 when it comes to phasing. The main point of phasing is to say, okay, let's get all of these problems done first, then these problems second, and so on. So that way, when the patient is scheduled in, you know to start at phase 1 and then work your way up all the way to the end. Now, there are certain things that are in the treatment plan which are unphased. The most common thing is the recare exam and the cleaning, which we'll get to later. Now, let's talk about phase 1. So phase 1 tends to be things that's related to the gums one way or another. Now, We have the regular adult cleaning, which internally is called a prophy in Clear.Dental. The proper term that the ADA likes to use is adult prophylaxis, but internally you will see the term prophy. We tend to tell the patient that's a regular cleaning. The other type of cleaning is scaling and root planing. Now, that's also known as a deep cleaning. Both of these are to make sure that the gums are nice and healthy before we get to the next phase. Now, is it 100% required in order to do things like a cleaning before you do something like a filling or a crown? Well, it's not impossible, but in general, we like to do things in phases. There are also certain procedures like root canals, which can be done in whichever phase, either phase 1 or phase 2. One of the reasons why it's so easy for a doctor to change the phase of any kind of procedure is because it's up to the doctor's discretion. Yeah, if that tooth is bothering the patient, we should probably do the root canal sooner rather than later. There are situations where the scale and root planing could take 2 or more appointments, so rather than waiting for all the quadrants to be done, the root canal may be done sooner. In those cases, they might even be unphased. But these guidelines of what is in phase 1, 2, and 3, these are general guidelines that are implemented when you use the auto phase button. So don't get too surprised if a particular doctor has a completely different form of phasing. So they finish up everything in phase 1, and then phase 2 tends to be fillings. That is also in the operative module. So any kind of composite or amalgam will launch the operative module in Clear.Dental. There is a separate module for crowns and bridges. They're actually the same module. It's a little complicated to explain why that is, but long story short, bridges are just really complicated crowns. There is a separate module for implants and a separate module for dentures. Normally, we would like to do dentures after doing crowns and bridges. If you are doing things like extractions, they could be immediate dentures, but that is kind of outside the scope of this video. And then we do things like night guards or periodontal maintenance. So after the patient does all 4 phases, phase 1, 2, 3, and 4, they actually go to what's called the recare phase, in which they would come in about every 6 months. Now, the 6-month standard is actually more of an insurance thing rather than a actual evidence-based requirement. So we like to say 6 months by default, but there are some patients that needs to come in every 4 months, some needs to come in every 3 months. There's some rare cases and patient doesn't need to come in until 12 months. But of course, that's another thing for the doctor to decide. So anyway, when you get a recare, you get 3 things, sometimes 2. The x-rays, which are normally done in this practice every once a year. You have the periodic exam, which is a different decode, because when you're doing the comprehensive exam, you're doing a full, thorough look at every tooth, brand new charting. When you do a periodic exam, it's much faster because everything has already been charted. You're just looking for whatever is new. And then you do the cleaning. This may be the correct code. This may not be the correct code because there's actually a separate periodontal maintenance, but we won't worry about that. But Let's just say the patient comes in for their regular 6-month exam and cleaning. And the doctor comes in, takes a look at the teeth, and finds no problems. So, what is the patient's next appointment? Well, it would be in another 6 months. So, in a perfectly healthy patient, they will forever be in this recare phase. We know we're having a nice, orally healthy mouth. We have a very healthy patient overall when all they're doing is coming in for their 6 months. But of course, there could be a situation where, since the last 6 months, the new cavity has formed. So we need to take care of that. So then they go kind of out of this recare phase and back to these phases all over again. But that is more up to the doctor what needs to be done. But the idea is that they would go through whatever phase 1 through N and then go back to the recare phase once all of that is completed. So that is the life cycle of the patient. This is a very broad overview, and next video we're going to actually go through step by step through all of the modules to explain exactly how the patient goes through every one of these items.